Hello, everyone. My name is Solomay Tibabu. I'm the host of the Going Digital Behavioral Health Tech Conference. I'm so pleased to have Emma Hu from Purchasers Business Group on Health and Emily London from AbleTo. Welcome.
Hello, everyone. I'm Emma Hu and the Director of Value Purchasing at the Purchaser Business Group on Health, where we support our large corporate members and public agencies in advancing value in healthcare and accountability. I lead some of our mental health initiatives to promote behavioral health integration in primary care, as well as to look at ways in which we can expand access through digital health and also promote measurement-based care.
Hi, everyone. My name is Emily London. I formerly worked at PBGH, or the Purchaser Business Group on Health with Emma, for almost a decade. And I recently made the move over to digital health. And I now work at a company called AbleTo, which is a provider of digital mental health services. And I've been in healthcare for 15 years now. It's a passion area of mine. I grew up in a medical family and saw the struggles that my parents faced as physicians trying to deal with the medical system. And I started looking for bright spots and ways that we could make the healthcare system work better. So I've been doing that ever since.
Emily, let me start with you. How does mental health impact employers and employees?
Oh boy, this is a big one. Mental health has a huge impact on both employees and employers. First of all, conditions are very common. As they are in the general population, they are also common in the workplace. There are estimates that range from 10 to 30% of US workers suffer from a clinical level mental health condition. That's a lot of workers. And in terms of the impact on employers, there are direct impacts and indirect impacts. The direct impacts are massive in terms of spend. There are estimates that anywhere between $100 to $225 billion are spent by employers every year on costs for mental health. And then in terms of indirect cost, there are lots of issues with productivity, absenteeism, employee engagement, morale, and turnover.
So huge opportunities for supporting employees with their mental health. Emma, can you talk about what challenges employers might struggle with in attempting to do that?
Sure. I think the top challenge that we hear from employers is access, connecting members with providers when they need assistance. And also, more broadly, stigma is still a concern, even though many organizations have provided training and communications to support use of EAP programs and access to providers. There's also certainly challenges in matching individuals to providers that have the specific expertise that can support their needs, as well as measuring outcomes and evaluating how programs are operating. Because employers have struggled with access, many of them have identified carve-out solutions or also augmented programs that are in the digital space, but then that creates new challenges of how to knit that back together with primary care and coordinating that care across the continuum of services.
Yeah, I'll just add a few sentences to that point. Access is a huge issue. We would have hoped that mental health parity would make access better. It's still a big challenge. We actually at AbleTo just did a secret shopper exercise, super undercover, where we called 550 providers based on health plan provider directories. And the results were really surprising. Even just the experience of doing this, trying to hypothetically find care, was very eye-opening. 75% of the providers we called were not accepting new patients. 18% had an appointment available within 1 month, and only 2% had an appointment available in 72 hours. Access is definitely still a challenge.
Yes, wow. That being said, I am a bit hopeful about what opportunities there might be for digital to expand access. But generally, Emily, can you talk about what types of solutions employers are using?
Yeah, this is a tricky one because there's not a lot of data that's publicly available saying what types of solutions employers are using. There are some general stats out there, and we know that almost every employer is offering telemedicine and virtual health right now because of COVID. But in terms of mental health specifically, it's a little hard to say. But the key solutions that employers are using in general are telemedicine suppliers. That could be, just purely phone-based care or virtual visits. They also usually offer an EAP solution, which has always been digital for the most part, and definitely is now. And there are also purely digital solutions that are app-based that employers are using. And the range of the types of solutions employers are using varies pretty widely. There's a spectrum of different concerns that these digital solutions can address. It can range from prevention to mental health wellness to moderate severity to full-on clinical condition care.
There is a lot of opportunity in terms of training, and I think COVID has also taught us some lessons about issues like resilience, and that's an important component of wellness training. We also find that employers are trying to address issues like loneliness and social interactions and ways in which they can support employees in this remote environment. And I think one of the other elements that relates to prevention is promoting that measurement that enhances the level of screening that members receive when they're seeing their providers, whether it's in the primary care office or with a specialist, that they're being screened for anxiety or they're being screened for depression and other issues that often are underdiagnosed in the absence of some of the structured screening.
Emma, you mentioned COVID. Can you talk a little bit about that and how that's played a role in employer mental health offerings?
Sure. It certainly has expanded the digital offerings that employers are using, as both the traditional providers have expanded the channels through which they communicate with patients, whether it's telephonic, video, or both. We also have found that many employers implemented digital solutions to enhance the self-care component so that people could access these tools, basically, when it was convenient, based on, their specific interest or needs with respect to, managing a hectic schedule, managing kids at home, or dealing with stress at work. So there are a variety of ways in which employers have expanded some of these tools and capabilities, as well as some of these programs that offer intermediated chat with providers, as well as facilitated referrals to mental health specialists. But I will note too that I think that COVID has highlighted some of the opportunities to improve health equity, because there is also a lot of concern that even as we grow this reliance on telemedicine and video access, on the one hand, it enhances access, but on the other hand, if you're in a rural market that doesn't have great broadband access, or you're in a crowded household and don't have a private room to speak to a therapist, those can be tremendous barriers.
Absolutely. So it sounds like there's actually a number of solutions available. Employers are doing quite a bit with them, but Emily, are employers even happy with these solutions?
That's a very good question. It's the $64 million question. Actually, it's worth a lot more now with the recent investments in digital mental health. The answer to that is complicated. All I can say is that I did my graduate thesis on employer use of digital mental health, and what I found was really a mixed bag. There was no blanket, yes, we're very happy, or no, we're very unhappy with the solutions. It really depended on the amount of utilization an employer was able to get to. If you don't have a lot of people using your solution, then it's hard to evaluate if it's working or not. But the employers that went with a solution provider that really focused on engagement were very satisfied with the tools. The employers that went with a solution that was harder to find, it was really hard for them to say if they were happy. But the bottom line is that it's really important to focus on utilization. The tools only work if people use them. So for an employer, it's important to understand what your solution provider is doing to increase engagement with employees. And also employers need to have their own strategy to increase employee adoption of the tools.
You mentioned utilization. For those in the audience who maybe aren't so familiar with even like the business models, how a lot of these solutions price their services, it's by utilization or PMPM. Can you talk a little bit about that?
Yeah, I can take a stab at that one. It really depends by the solution provider. Some of them charge a flat fee per month, and it doesn't matter how many employees use the service. The employer is always going to be charged the same amount. It could be an annual fee, or, in the case of AbleTo, we are an in-network provider for the health plan. So we only charge if the service is used. But it really varies by solution.
It does raise a question of how engagement is measured. Is it the number of clicks or online uses of a tool? Is it the completion of a module, or in some cases, graduation from a program if it's oriented towards education? There are a number of approaches to looking at engagement in the completion of content or repeat visits. So, as employers look at these vendors, it's important to have a good sense of, what your goals are. Is it the volume of members that access the tools? Is it the volume who complete a particular module? Or is it ultimately outcomes, which goes back to the issue of measurement-based approaches that look at screening and is there remission, for conditions like depression or anxiety? Is there improvement in quality of life if an individual, identifies isolation as a concern? Or do they reflect back the training that they may have received in terms of daily practices like mindfulness?
Emma, you're already starting to expand on some great metrics that employers should think about. Can you talk a little bit about any other important factors employers should think about in terms of successfully adopting digital?
Sure. I think, at the end of the day, that one of the key issues is to have a clear set of goals and understand, what problems are you trying to solve? Is it access? Is it engagement? Is it, creating access points for different, personnel? People may have preferences around using digital tools that don't require face-to-face interaction, where other individuals, might benefit from that face-to-face interaction. So I think employers have been exploring, ways to expand the channels and avenues through which people can access mental health support and identify issues that might relate to workplace productivity, or may also relate to their self-care in managing other chronic conditions, because so often we find that depression, anxiety are underlying conditions that influence how a person reacts to other issues and how they manage their care with respect to other chronic conditions. And we know from an aggregate level that individuals who are seeking help for their mental health issues and getting support often are in better condition relative to other chronic disease issues, and are able to engage with their providers in a more effective way. So at the end of the day, it's a win-win.
Yes, really great advice. And Emily, anything you'd add in terms of how employers should think about selecting a tool that's best suited for them?
Yeah, I concur with the foundational question that Emma posed. What are your needs? It will really take a look at your claims data, understand what conditions your employees are struggling with and where your employees fall on the severity spectrum, and pick a solution that addresses exactly what your needs are. And it could be multiple solutions. No one solution is going to work for everyone. It's really individually targeted. That's really important. In terms of, what makes a good tool, I would say, a good tool provides really three facets. There's access, it's foundational. You need to get access to care. There's quality, and then there's also outcomes and value. So those are three really good things to look for when selecting a tool.
And I think one of the big challenges is that there's such a huge proliferation of tools, how to really make those evaluations. And, I think at the core, employers also need to be assessing vendors for how they credential providers. If they're offering a panel, what are the selection criteria? How do they recertify them? How do they validate that those providers have access in their appointment schedules, and what is the response time with respect to individuals that might be engaging through a chat box or email or other tools. And I think at the end of the day, we have different measures like Net Promoter Score or overall patient experience, but I think concretely, employers are also looking for formal measures of quality outcomes. And, if individuals are doing better, as a result of engaging with the tools, what benefits have those tools provided, and how do they support employees on an ongoing basis, as well as dependents at home, because oftentimes the communications may go directly to the employer, but it might be an adolescent at home who's having challenges, or a spouse who needs specific support.
Yeah, I think it's also important to look for tools that can be tailored to the needs of the patient. There's not one set curriculum that a supplier is saying is going to work for everybody. There should be different modules to pull from that are specific to the needs of each patient that comes through the door. And there should also be a care coordination aspect. We don't want to create complete fragmentation of care. There are 10,000 different options out there. And hopefully the patient only has one PCP. There's no way the PCP is going to coordinate with, all these different options a patient might be encountering.
This is all really good advice in terms of how employers should think about evaluating and procuring a solution. But once they make that purchase, how should they think about communicating that it exists to employees?
There's a lot of different avenues. Many employers have very focused efforts during open enrollment, but this is really a year-round issue. So whether it's through email, push communications or newsletters, what's also really effective is testimonials by leadership in the organization, both to address the stigma issue, but also set examples around the value of these services, and having people share experiences around what benefits they experienced, and their own stories will engage other people. And so that's a huge opportunity. There are also some tactical things that employers can do, such as offering single sign-on so that the tools are readily accessible, or having information that also provides assurances to employees around the security and privacy of the interactions. That's also an important element.
And one other tactical solution that I would recommend is working with your employee resource groups. That can be a really powerful avenue to, develop internal champions and have peer-to-peer support. And if an ERG is really focused on anxiety, it's May Mental Health Awareness Month. This is a great time to really bring those issues to the fore and, just normalize mental health conditions and mental health and wellness.
Yes, reducing stigma, normalizing mental health, all things that I hope are in our near future, which, speaking of which, Emily, where do you see the employer market headed in the future?
Oh, I wish I had a crystal ball. I think a few things are going to be happening in the next couple of years. I think we're going to continue to see an uptick in digital mental health. We know that investments have skyrocketed in the last few years, and COVID has just propelled digital health into the mainstream. I don't see that slowing anytime soon. And I think there will be after effects to the COVID pandemic. We've seen a drastic increase in mental health needs during the pandemic. I think we're going to see the effect of the pandemic for years to come. And I do think there should be more resources available to employers to help them navigate through those 10,000 available solutions. I think, as Emma said earlier, it's just really hard to know which is the right tool, which one gets the highest utilization, which one has the best outcomes, how do I evaluate all the evidence? I'm hoping there will be some better resources coming out to guide employers. And last but not least, I think there's going to be a lot of consolidation in the market. I think there are a lot of new players coming in, and there's only so much network capacity that's available. So there's going to be a lot of vying for those providers. And I don't have a crystal ball to say who's going to come out on top, but I do think we're going to see a lot of mergers and acquisitions in the coming years.
And I would also add that I think the market in the provider sector is also expanding as integrated medical groups and primary care practices that bring behavioral health in also augment the services that they provide their patients and refer them to, so that there's an opportunity to better integrate the care experience that members receive, but it also may reinforce engagement if it's a referral from a primary care physician. So there's definitely opportunity there as well.
So Emma, what do coalitions like Purchasers Group on Health do for employers to help navigate adoption and things like privacy and security?
One of the things that as a coalition, we have many employers that have tested different solutions, and we create an environment where employers can share best practices or trade information on approaches that they've considered. And so through the vehicles of member sharing and webinars, we help identify some of those opportunities. But we also have learned from our employers that many of them have advanced approaches when they're dealing with data and security issues. Many of them, for example, have like a standard data compliance requirement that they enforce with all their vendors, not just in the mental health space, but any medical or other ancillary provider wellness and so forth. And it's really important when employers are communicating this information that they're identifying a third party that is providing the support and providing the information and tracking the information with primary care physicians. The employers at no time are receiving any of the data, so that the assurances are provided to members that their communications will be private with the digital vendor or telehealth provider.
Well, I have so many more questions, but I know we're already out of time. Thank you so much, Emily and Emma, for sharing your expertise with us today.